Hi, I'm Greg Feldman, Director of Public Health in Sheffield. This is a winter message for local businesses. So a few introductory thoughts first. One, it's been a difficult 18 months for businesses. I guess that goes without saying. It's been a difficult 18 months for the city and for the country. But your business and every other business is key to keeping Sheffield thriving, keeping the economy and the community going, and giving people pride in where they live. So let's not, whilst it's been difficult, let's not underestimate the amazing work that you have all done. Your business is also key to keeping the community safe from COVID by helping prevent the spread of infection amongst the workforce and your customers, and many of you are leading by example, and thank you for that. COVID, sadly, still does pose a real risk to us, our loved ones and our economy, and we're still wanting to take some measures that tread the balance of keeping everybody running, keeping everybody in operation, but also keeping people as safe as possible. We know from lots and lots of feedback from lots of businesses, they've told us footfall is a difficult challenge. Issues with hiring, cash flow, getting hold of stock are all putting extra pressure on you, and I'm told that many customers are now not observing COVID-safe measures, even when you ask them to do so. But for those of you that are asking, thank you, because it has made a difference, definitely. So thanks for your efforts. It's worth you knowing that the COVID-safe working remains worthwhile. It has made a difference. We'll never be able to count that, but it's definitely made a difference, and I'd encourage and urge you to do everything that you can. Here's why it matters that we keep going with some COVID-safe ways of working. Firstly, vaccines offer very, very good level of protection, particularly from serious disease and from death. So they're doing the job that they promised they would do, they're doing the job that it says on the tin. They're not 100% effective, and they don't completely prevent people from catching and passing on the virus, COVID-19. So, you can be fully vaccinated, but you can still acquire the virus. So we're advising people to carry on doing the things that have prevented transmission: hands, face, space, opening windows for fresh air, ventilation, etc., and regular self-testing. The government's still operating to Plan A that was within the roadmap that formally came to an end way back in summer. Many of the measures are advisory. Many of you have carried on with those measures, and thank you for that. There was an outline for Plan B, and the proposals within Plan B were customers for some settings might have to prove that they've been double vaccinated. Face coverings may again be legally required in some settings, and the government may ask people to work from home for a limited period based on the data at the time. I don't know whether Plan B will come into force or not. I've mixed views and mixed opinions on the likelihood of it. There's a lot of pressure from NHS and social care leaders for the government to implement restrictions, because the NHS and social care is in a very, very, very difficult space. They're on purple and black alerts in November, and normally we don't get to those kinds of levels of activity and pressure until at least January, February, in a bad flu year. Flu hasn't even started yet, so the pressure is definitely in the NHS and social care, and there's pressure from NHS and social care leaders to keep us all protecting ourselves. So it's important that you do try to manage crowds and queues, that you do try to manage communal spaces and canteens for an office-based business. Try to manage face-to-face interactions for your customers. Encourage people to wear face masks, encourage people to wash their hands regularly, etc., because those things have definitely made a difference. So here's a reminder for what all businesses can do. One, keep going. That's most important. But have faith that what you are doing is helping to make a difference and helping to keep yours and other businesses open, because the last thing any of us want is to go back into some form of lockdown where we close certain sections of the economy. That's bad for everybody, and nobody wants that to happen. Update your risk assessment, and is COVID included? So the kinds of things that I would encourage. Most importantly, encourage the workforce to get vaccinated if they haven't already done so. So both initial doses and boosters where eligible. And there are still lots and lots and lots of people aged 40, 50 or more that haven't yet had dose 1 and 2. That by far is the most important thing to protect them, by a long way. Flu jabs. All of the evidence says this is going to be quite a bad flu year. We didn't have flu at all last year. There will have been some waning immunity from flu, and views are mixed on whether or not this will be a bad strain, a virulent strain this year. So I think it probably will be. So I'd encourage everybody to have a flu jab, particularly those aged over 50 and or with a long-term condition. Flu jabs work, they help prevent the risk of serious disease from flu, just as COVID jabs do the same from COVID. Review ventilation in your workplace, simple stuff, allowing fresh air in indoor spaces, just gets airflow going and dilutes virus that's in the air. Opening the door for 10 minutes every hour will make a difference. If you have mechanical ventilation, set it to maximum and keep it well maintained. If one of your staff tests positive, take action straight away. They should be at home, and they should be at home if they have symptoms. They should be at home actually if they have symptoms from flu-like illnesses or serious colds. I've just had the worst cold of my life, and I'm glad I didn't come to work to spread it. So it was awful. It wasn't COVID, thankfully. So people who test positive, or people who have flu-like symptoms or COVID-like symptoms, should stay at home and take a PCR test, even if they've had both vaccinations. Make it easy for your staff to test at work if they're already doing so with lateral flow device tests, and think about the familiar principles of hands, face, space, because it has made a difference. Everything you do that reduces the risk of your employees and or your customers getting COVID makes a difference to you and your business, but also makes a wider difference to the Sheffield community, and all of that makes a difference. I get it's hard to prioritise that when they've got so many other pressing things going on, but all we can do to get us through the autumn and winter will help the city. There's no two ways about that. So, final point, what you do is vital to the economic activity of the city and the economic health of the city. There's no two ways about that. We want you to thrive despite the difficult winter we're going to have with COVID, and we want to offer you as much support as we can. And there are lots of resources available for the business community. If there's one thing that I'd encourage you to do today, look back over your risk assessment and make sure you think about the encouragement for staff to get vaccinated, encouragement for ventilation. What will you do if a member of staff tests positive for COVID? That was the one thing I think I'd encourage you all to do today. But for those businesses who are doing a lot already, thank you, because it does make a difference, has made a difference, and will continue to do so. And please look on our COVID support page for local businesses to find out, and there's lots of simple information there and lots of good tips and tricks there. Thank you.